Irritable bowel syndrome, commonly abbreviated as IBS, is a chronic functional gastrointestinal disorder that affects the large intestine. Unlike structural diseases such as Crohn's or ulcerative colitis, IBS does not cause visible inflammation or damage to the intestinal tissue. However, it can still significantly impact an individual's quality of life. IBS is considered a functional disorder, meaning it results from problems in how the gut functions rather than a physical abnormality. It is one of the most commonly diagnosed gastrointestinal conditions worldwide, affecting an estimated 10 to 15% of the global population, though many cases go undiagnosed. IBS manifests as a group of symptoms that occur together, most notably abdominal pain, bloating, and changes in bowel habits, including diarrhea, constipation, or a combination of both. The condition is classified into several subtypes based on the predominant bowel habit: IBS-C, IBS-M, and IBS. While IBS is not life-threatening and does not lead to serious disease or colon cancer, it can cause persistent discomfort, emotional stress, and interfere with daily activities. The exact cause of IBS remains unknown, though several contributing factors have been identified, including gut-brain axis dysfunction, hypersensitivity of the intestines, altered gut motility, and imbalances in gut microbiome. The relationship between IBS and nutrition. Nutrition plays a crucial role in both the development and management of irritable bowel syndrome. Although IBS is not directly caused by food, dietary habits and certain foods are known to trigger or exacerbate symptoms in many patients. One of the most significant advancements in recent years has been the identification of the FODMAP group of carbohydrates, disaccharides, monosaccharides, and polyols as potential culprits in symptom. These short-chain carbohydrates are poorly absorbed in the small intestine and ferment in the colon, leading to gas, bloating, and diarrhea. The low-FODMAP diet, developed by researchers at Monash University, has become a cornerstone in nutritional management of IBS. It involves a strict elimination phase, followed by a gradual reintroduction to identify specific triggers. Beyond FODMAPs, other dietary factors influence IBS symptoms. High-fat meals, spicy foods, caffeine, alcohol, and artificial sweeteners can also aggravate symptoms in sensitive individuals. Moreover, irregular eating patterns and large meals may overstimulate the gut. On the flip side, certain dietary choices can support digestive health and alleviate IBS symptoms. Soluble fiber, found in oats, bananas, and carrots, can help manage both constipation and diarrhea. Probiotic-rich foods like yogurt and kefir may also improve gut microbiota balance and reduce bloating. Importantly, nutritional management must be individualized, as trigger foods and responses vary greatly among IBS patients. Symptoms and causes of irritable bowel syndrome. IBS is characterized by a constellation of symptoms that vary from person to person, both in nature and severity. The hallmark symptom is abdominal pain or cramping, typically relieved by a bowel movement. Other common symptoms include bloating, gas, a sense of incomplete evacuation, and altered stool consistency and frequency. Patients with IBS-D may experience urgent, loose, or watery stools, sometimes accompanied by mucus. Those with IBS-C often suffer from infrequent, hard, and lumpy stools. IBS-M presents a mix of both diarrhea and constipation, often alternating unpredictably. While these symptoms are not life-threatening, they are often chronic, recurring over months or even years, and can cause significant physical and emotional distress. The causes of IBS are multifactorial and still under investigation. Several contributing factors have been identified, including gastrointestinal infections, which can trigger a subtype known as post. Additionally, disruptions in the communication between the brain and the gut referred to as the gut-brain axis can lead to altered pain perception and motility issues. Psychological factors such as stress, anxiety, and depression are also strongly associated with IBS and may worsen symptoms. Hormonal fluctuations, especially in women, may play a role, as IBS is more prevalent in females. Abnormal gut motility and visceral hypersensitivity are physiological features of IBS. Lastly, imbalances in the gut microbiota. The trillions of microorganisms residing in the digestive tract are increasingly recognized as important in IBS path, particularly in relation to bloating and immune response. Treatment approaches for IBS and the role of lifestyle. Managing IBS involves a comprehensive, personalized approach that includes dietary modifications, lifestyle changes, psychological support, and sometimes pharmacological interventions. Because IBS-B varies widely among individuals, treatment must be tailored to the specific symptoms and triggers of each patient. Dietary management is often the first line of treatment, particularly the low-FODMAP diet under the supervision of a dietitian. Gradually reintroducing FODMAPs helps identify individual intolerances, while preventing unnecessary dietary restrictions. In cases of constipation predominant, IBS increasing soluble fiber intake and hydration can improve symptoms. For diarrhea predominant IBS, limiting caffeine, alcohol, and high-fat foods is often recommended. Probiotics and prebiotics may help restore a healthy gut microbiota, though results can vary. Beyond diet, lifestyle modifications such as regular exercise, sufficient sleep, and stress management play a vital role. Cognitive behavioral therapy, mindfulness, and gut-directed hypnotherapy have shown effectiveness in reducing IBS symptoms by addressing the gut-brain connection. Medications are used when symptoms persist despite lifestyle interventions. Antispasmodics can relieve cramping, while laxatives or antidiarrheals manage bowel irregularities. Newer drugs, targeting serotonin receptors in the gut, can regulate motility and sensitivity, but are generally reserved for severe cases. Antidepressants, particularly tricyclics and SF, may be used in low doses to reduce pain and modulate gut-brain interaction. In summary, while IBS remains a complex and chronic condition without a definitive cure, it can be effectively managed through an integrative strategy that prioritizes dietary awareness, emotional health, and patient education, empowering individuals with the knowledge to understand their condition and identify personal triggers can significantly improve quality of life and long-term outcomes. Thanks for watching.